So the event today is called the Community Questions on School Reopening for the Fall of 2020. And we're very fortunate to have two guest speakers, Dr. Kirk Lifeso, who is an assistant professor in the Department of Pediatrics at Queen's University. He's an expert in infectious disease, as well as Dr. Michael Diernick, who is an assistant professor, Department of Pediatrics, who's a Royal College specialist in respirology for children. So couldn't think of two better experts to have answer questions from the community on the school reopening for this fall. Thank you so much.
We are joined here today by Dr. Diernick and Dr. Lifeso and Dr. Moore to discuss questions that many parents in our region have had since the announcement of the return to school in September. So we're going to start right away with a question for Dr. Lifeso. What are the key messages parents and caregivers should reinforce with young children or older children to reduce the risk of COVID-19 and keep them healthy?
Sure. Thanks for the question and the opportunity to provide some answers. I think that the key messages really here are that all members of the family, not just kids, need to be mindful of their activities both in and outside the school setting. Children are most likely to acquire coronavirus, the evidence points to, from infection within their home environment from an adult household member. So everyone needs to be cautious, and everyone needs to remember to protect themselves, and that's limiting their exposure to closed spaces, close contact with people outside of their family and outside of their social bubble, and crowded places, and to remember the principles of good hygiene and infection control that include excellent hand hygiene frequently, masking when physical distancing is not possible, and keeping distance. And really that the risk of getting coronavirus in any place in our community is really related to the amount of coronavirus in the community. So if we keep coronavirus out of our community and limit the amount of spread within the community, then we can continue to keep schools a place that is as safe as possible to send our children.
Yeah, so one of the key components is on a daily basis to ask your children and yourself if you've got any signs or symptoms of COVID-19. And the commonest symptoms are fever and or cough and or increased difficulty breathing. But there are minor symptoms as well, such as laryngitis or low-grade fever, sometimes nausea, vomiting, or diarrhea. And if you have symptoms of COVID-19, potentially compatible, you should contact your healthcare provider and potentially get assessed at one of our assessment and testing sites. We're very fortunate in Southeastern Ontario to have multiple areas of our community where you can get tested very quickly and effectively. And so we want our community to maintain a high level of testing so we understand the risk of infection in the community.
Thanks very much. Another question we received, what would you recommend students do with their face coverings to avoid contamination when they do not need the face covering on, like when eating or outside for recess? Dr. Lifeso, did you want to help us out with an answer for that?
Sure. So it's important just to remember that we want to keep these face coverings clean. So once they're removed, and they should be removed in a fashion that keeps you clean and safe. So hand hygiene before removing, and removing as gently as possible by the ear straps. But then placing the mask in a paper bag or another container that limits moisture within the container to keep them dry. And this will keep them clean and protected while you're not using them, and then they can be brought out and replaced onto the face after. It's just one other reminder here, just that the type of face covering does matter, and so preferably machine washable, dryable cloth, tight weave cloth such as cotton or linen with 2 layers, if you make them or purchase them at home. And it's really important as well, too, that people don't use or avoid masks that have these little buttons or exhalation valves on the side, because those defeat the purpose of the mask, which is trying to keep adults and children's respiratory droplets inside and prevent them from being expelled outside. And the little exhalation valves, while they may make it feel a little more comfortable, they actually allow a direct route for your respiratory droplets to proceed out of the mask and into your local environment.
Thanks very much. Can children with some medical conditions like asthma still wear a face covering? Dr. Durink, would you have an answer for that?
Yeah, so thank you for the question. So children with most medical conditions can wear a mask, and actually some of the ones that are more at risk are some of the people who would benefit most from wearing masks. The most common reason to not be able to wear a mask would be more related to irritation from the mask, an allergy from the mask of the skin itself. You might see that some people would find that it feels unusual to breathe through a mask, but this in and of itself isn't dangerous to people when their underlying illnesses are well controlled. It is important, again, to make certain that the masks are well cleaned, especially in some respiratory conditions like cystic fibrosis, where we can be concerned about bacteria that may grow in masks. And so ensuring the appropriate care is important to making certain that all patients are able to use their masks safely. If you are worried about your child's ability to breathe using a mask, I would suggest touching base with your healthcare team for review to look at their underlying illness control to make certain that they're able to breathe effectively through a mask. We would also like to note that at this point in time, for people who typically restart medications for illnesses like asthma, it would be a reasonable thing to start those even now before the school year starts, so that people are as healthy and well controlled heading into the school year as possible.
Thanks very much. Dr. Leifso, would you recommend for parents and caregivers with children in grades kindergarten to grade 3 with regards to wearing a face covering at school, would you recommend that children do wear face masks under, grade 4?
Yeah, so there's certainly some debate around this, and there are differing opinions on the age at which children can or should wear face masks. So some of this may be up to each local school or school board or health region. But in general, I think we can certainly give children credit for being able to do things that seem difficult to us or seem difficult to them, but they actually put up with quite easily. And so I don't actually see any difficulty for most children learning how to use masks and wear them appropriately when needed. In fact, I see children in my own clinic who are sitting wearing masks totally appropriately with no problem. And if a child is going to go to school wearing a mask, then it's really important to introduce that concept to them before they go back to school, and to model it at home and in the community when you're going out and actually wearing masks in places. So, taking them out, starting, if they haven't worn a mask before, starting with wearing a mask for a short period of time on one day, and then gradually increasing the amount of time that they're wearing it at home until they do go back to school. So let's give children some benefit about actually, they will do what's required of them, but also what is good behavior if it's modeled and reinforced positively, before they go to school and also when they get to school.
Thanks very much. Dr. Durink, what are messages parents and caregivers can give young children on how to decrease their risk if they are unable to maintain a 2-meter distance from other students in the classroom?
Yeah, so this is something that starts even at home before kids are going to school, and sort of thinking about those questions day to day in terms of, are kids showing signs and symptoms of being unwell? And if they are unwell, staying home from school, seeking further assessment, whether from their healthcare provider or at one of the COVID assessment centers in the region. And then beyond that, continuing with sort of the things such as mask wearing, frequently washing our hands are also important things to help to try and prevent any transmission and spread when we're not able to physically distance. In terms of other things we can look at in the classroom in particular, we could also look at things like ensuring that kids have their own supplies. They aren't sharing pencils, pens, trying to limit sharing of books where possible, just again to try and decrease some of that interaction where things may be transmitted between people. And again, looking at other things outside of the classroom in terms of how kids are getting to school, whether they need to be on the bus versus is it possible for them to be dropped off by families, and seeing other ways that we might be able to try and, again, decrease opportunities for transmission between people.
Thanks very much. Dr. Lifeso, what are some key messages to families who may have multi-generations living in the same household, and in terms of reducing risk for older family members?
Yeah, so this is a challenging question in that each family unit may be different. Really the strategies that you might use in your household are the same as we've been suggesting to use for children. And really that's about reducing your risk in the community in order to reduce your risk at home. So safety measures for all members of the family when they go out into the community, such as maintaining physical distancing, avoiding closed and crowded spaces and close contact for a long period of time, masking when outside the home, and physical distancing is not possible to do. And then within the home, respiratory etiquette like cough etiquette, frequent hand hygiene, even within the home, using either just plain old soap and water, which is very effective, or alcohol-based hand sanitizer. But one of the other things that can be done is to see your physician and discuss the strategies for each individual family member who may be at risk, and set up some sort of prevention strategy for those individuals.
And just in follow-up with those prevention strategies, those are very good comments. Anyone with older that has a chronic medical condition, they should be in contact with their primary care provider. There's virtual care being provided. Ensure that their underlying medical illness has been stabilized to the best means possible, and medications are stabilized now going into the fall. Also, there should be a review of immunizations to ensure that all publicly available immunizations have been made available to these individuals and they're best protected going into the respiratory season, which starts next month. So there's a lot of strategies we can put in play right now to protect in multi-generational homes, and it's a very good time to contact your primary care provider to ensure that you've got a prevention strategy in play.
Thank you. Dr. Derink, are there underlying medical conditions that increase the risk of severe illness from COVID-19, like pregnancy or asthma?
So, this is something that we continue to learn more and more about as we've been learning more about COVID-19. Looking at adults, we definitely know that there are some medical illnesses like diabetes, high blood pressure, chronic lung diseases that do seem to increase the risk of more severe illness. When we look at children, often we find that even children with some of these underlying respiratory difficulties don't seem to be as commonly having significant problems with COVID-19. And in general, we do see that children have less severe disease than adults. That being said, we do know that younger children in particular, children with respiratory illnesses, children with immune problems, are at more risk of having difficulty with viruses in general, and including with other coronaviruses. And for that reason, we still want to really work to try and protect these children from COVID-19. And this includes everything that we've sort of been mentioning in terms of maintaining physical distancing, wearing masks, good hand hygiene, ensuring that children have their appropriate vaccines, but also ensuring that their underlying medical conditions are under good control. And for that reason, it would be a good idea to touch base with your healthcare team to ensure that they are using all of their medications. Also, for any patients that do have asthma in particular and who may take a holiday in their medication use over the summer, they should be restarting their medications for at least a couple of weeks before restarting the school year.
I just wanted to agree with Dr. Derink and just add that as we move forward into this, into school reopening and into the respiratory season, or at least the season where we typically see respiratory infections in children, that it is equally as important to not avoid going to the hospital or seeking medical care for children as you would normally. In our region, in our hospitals and clinics, it's extremely safe with the mitigation strategies that we have in place and infection control strategies that we have in place. And the consequences of not seeking care or delaying treatment in children, especially in children with underlying medical conditions, can be significant. So if you would be seeking care for these children, then you should continue to do so.
Thanks very much. Dr. Moore, what are the current tools to assess the risk related to potential community spread?
So all of our sister health units in Southeastern Ontario have great websites, and on those websites, there are daily updates to total number of cases with an age distribution and often with mapping associated with it. So I think it's very important that our community visit those websites from time to time, be aware of the risk. And I have to say the risk in Southeastern Ontario is very low. We're very fortunate that our communities have embraced prevention strategies, and it bodes very well for our reopening of the schools for this coming school year. And we have to maintain that momentum as we go forward. But visit the websites. That will tell you what the risk is in the community and in your neighborhood. And those will be updated on a regular basis across the Southeast. And just be aware of the current risk, which remains low in our community and bodes very well for a safe opening of our school system.
Thank you. Dr. Lifeso, how can students stay safe during lunch periods when they are not wearing a face covering?
Yeah, so this is another good question. Lunchtimes certainly are important times for children, not just for eating, but also because they get to socialize with their cohort. And we're going to repeat the same messaging really, which for each individual child, it's the risk reduction strategies are the same as if they were out in the community at home, and that's maintaining physical distancing as much as possible. Eating outside if possible. We're in a well-ventilated area. When eating inside locations, well-ventilated areas as well too. Not sharing of food, not sharing utensils. Keeping all that stuff to yourself. And then there are environmental or infrastructure mitigation strategies that each school will have to come up with, and those things could include staggered lunch times or other mitigation strategies. Good hand hygiene before and after eating, and before and after putting on and taking off the masks or face coverings. So really, it's those same strategies that we talk about, simple things or seemingly simple things that they can do, and that just need to be reinforced and modeled and positively reinforced throughout the day.
And also, just in follow-up, the local public health agencies are working very closely with school boards to provide guidance on infection prevention control and how to clean surfaces in a lunchroom and or frequently touch surfaces within the school setting. So, the vast majority of how this virus is spread is through direct personal contact of droplets that are sneezed or coughed onto someone. But there is that 10% that could be potentially spread through contact of high contact surfaces. So we're working diligently with the schools to ensure that high contact surfaces, lunchrooms are cleaned appropriately using products that will kill the virus and provide the safety that parents want to have in those environments.
Thanks very much. Dr. Moore, is there anything you'd like to say about what the plan is for if there's an outbreak in a classroom or a school and the process of contact tracing and communications in that event?
So over the summer months, we've been working diligently to have plans on how your local public health agencies in the Southeast will be able to respond to an event where a child was diagnosed with COVID-19 and had attended a school. Remember that the vast majority of spread of this virus is in the home setting, and we would investigate the home first, test adults in that setting, and do our risk assessment. If we think there was a risk in the school setting, we would communicate with the parents in that classroom and or the school. We would set up a means to test those that we thought were at risk for the virus, and we would do so in partnership with the parents, the school boards, and their healthcare providers. So we have been working on the ability to respond very quickly to any school-based activity with COVID-19, and we have plans in play. We also are working with our assessment centers and our primary care providers, and clearly with our pediatricians to ensure that we have a health system response as well. So be assured, we're working diligently with the school boards to prepare for this. We hope it doesn't happen too often, but we will see incidents of COVID-19 in classes, and we have an ability to respond, and we have a robust system now to be able to do rapid contact tracing. The other piece of this is laboratory capacity. We have very good laboratory capacity here in KFL&A and the Southeast. We're honored to have such rapid turnaround times with testing. We couldn't do it without that robust network of health professionals helping us, and we're very fortunate to have that.
Thank you very much. Dr. Lifeso, some families have expressed interest in using lanyards or eyeglass type chains around their neck to hold a face covering when they don't need them. Is there a safety concern around this? What would you recommend?
Yeah, so there may be a safety concern, but it's less about that and more just about good masking practices. So this is the same recommendation of mask storage when students are not using them in any other setting, including eating. So they should be removed in a way that is safe with hand hygiene before and a clean removal that isn't vigorous to dislodge any particles, but then stored in a paper bag or other container that does not retain moisture until they are going to be used again or until they're cleaned at home. So they shouldn't be worn on a lanyard. They should not be kind of tucked under your chin or around your neck when they're not in use. Keep the mask clean, because a soiled and dirty mask is less effective than a clean mask.
Okay, thank you very much. Dr. Lifeso, I've heard that you have a small family of your own. What are your plans this fall for sending your children back to school?
Yeah, no, I have 3 children in 2 different levels of public school, and as a family, we've made the decision to send our children back to school. In our area, it is safe. Or it will be as safe as it can be, because the levels of infection in the community are low, and the risk of catching coronavirus in your school is directly related to the amount of coronavirus that is circulating in the community. So and we've done a fantastic job at all levels, and we appreciate the leadership of the MOH in our community, and his team, and the team of infection control people here in the hospital, and the lab test. There's a tremendous number of people who are dedicated to keeping this community safe. And if we all do our part in limiting spread within the community, then we keep our children safe in their schools. And so I think that's the biggest factor that went into our decision making, was that our community levels have been and are at the moment so low.
Thanks very much. Dr. Lifeso, is there anything that you help teach your children at home that might better reinforce their actions when they're not at home?
Yeah, so the things that we would focus on when coronavirus came were really reinforcing of good principles of infection control, things like good hand hygiene and how to do it appropriately. There are some excellent resources out there on how to wash properly and get how to use alcohol-based hand sanitizer properly, or soap and water, which was just as effective against coronavirus if done properly. Early use and modeling of masks. If adults in the household are okay with wearing a mask and can show children that it's okay to wear, then children will follow that example. And it may take some reinforcement early on, some positive correction away from touching the mask, away from wearing it, under your nose, those sorts of things. But with time and with positive reinforcement, children get it. And it's reinforcing that these measures are done to help keep us safe, but it's also, we're doing these things because we care about our community and because we care about the other people in our community. And I wear a mask, not just really to protect myself, but to protect those around me and those who I come into contact with in the community, as a way of showing that I want them to stay safe as well. So we try to message that to our children and make this as normal a process as we can.